So they let me use the gavel a little bit for about 30 seconds while we go through the beginning part of the meeting. The first order of business, if you would stand with me and pledge the allegiance. Thank you. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Please observe the moment of silence. Thank you. This brings us to section 2 of the agenda, which is the organization of the school board. At this time, I would like to entertain motions to elect the chairman.
I'd like to move that Mr. Mills continue as chairman.
Second.
Okay, and all those in favor?
Aye.
Any opposed? All right, I guess I'll give this back to Mr. Mills then.
You did a good job.
You run a good meeting.
Here you go, sir.
I will,
Mr. Chairman.
thank you, dear. I will serve at the pleasure of this board. Is there any nominations for vice chair?
I would nominate Larry Grove to continue as vice
I have a
chair.
motion, Mr. Grove. Is there a second?
Second.
Second. You accept that nomination, Mr. Grove?
Yes, sir.
Accepts. All in favor, aye?
Aye.
Opposed, no. So ordered. Superintendent's recommendation for clerk, deputy clerk, and superintendent's appointment of designees. Do you want to cover that for us?
Sure, yes, sir. I recommend that Amy Rogers continue on as the clerk of the board and Michelle Berta continue as deputy clerk. And I also appoint Dr. Carol Johnson to continue to serve as the superintendent's designee.
All right, do we have a motion to accept those recommendations?
So moved.
We have a motion from Ms. Bynum. Is there a second?
Second.
Second from Mr. Rubin. All in favor, aye?
Aye.
Aye. Opposed, no? And so ordered. Is there an MVGS representative? Do you mind continuing, Larry?
I would be honored to.
We have a motion for Mr. Grove. Is there a second?
Second.
Second from Ms. Bynum. All in favor, aye?
Aye.
Aye. Opposed, no? And thanks for doing that. It's a very important role.
Yeah.
Election of representative and alternative for Headwaters. I would like to ask Rachel if she would continue in that role.
I'll be glad to.
Now, I'm not sure what we do since Ms. Meyer's missing. Can we nominate her and?
Yes, we
I think
can.
we can.
You have a, you have a quorum, Mr. Chairman. Do whatever you'd like.
Yeah, it's quite likely that's going to happen. She was our alternate, I believe.
She
Yes.
was, yeah.
So Ms. Meyer would be the alternate. Is there a motion to make?
So moved.
We have a
Second.
motion for Mr. Grove and a second for Mr. Rubin. Make Ms. Bynum the representative and Ms. Meyer the alternate. All in favor, aye?
Aye.
Opposed, no. And so ordered. Policy Committee, I believe Mr. Rubin and Ms. Meyer were on that last year. Are we okay
So
with that?
moved that they continue.
Okay, we have a motion that they continue.
Second.
We have a second from Ms. Bynum. All in favor, aye?
Aye.
Opposed, no. It's ordered. We did receive a meeting schedule. Are we voting on that later? I thought I saw a
Yes.
motion
Yes, we are.
on that later, right?
Step on the board.
Yeah. So do we have any comments or questions about this calendar at this point? We have a work session next Tuesday, right? Is today
Yes.
the 12th, the 19th,
That's
the
right.
19th?
Mhm.
And I think the next scheduled budget event is our February 9th meeting, which will be back in this location, but will be a joint meeting of both boards.
Correct. Mhm.
Is the work session going to be here or is it going to be in the office?
It's
said-
here.
It's here.
It's here,
It
right?
was slated
Yeah.
as here. I think
Yeah.
that's a good,
Well, we have to have room. So the
Mhm.
boardroom is, if people show up,
yeah.
Yeah, that's
they
fine.
have from time to time. So we'll be back here next Tuesday at, was it 6:30? I think it was.
6:30, yes, sir.
Our work session regarding the 21-22 budget. And we'll be voting on that calendar later. Any questions or comments or changes? No? All right. We welcome you to our monthly meeting. We're here to accomplish the business of schools for the sake of our students. We do want to hear from our citizens, and there is time for public comment prior to action items on the agenda. We ask that speakers identify themselves and their home district. We also ask that your comments are limited to 3 minutes in order to provide equity to all speakers and to ensure the meeting is reasonable in length. If you have more information that can be summarized in 3 minutes, please leave behind materials for the board's review. The moderator will ask you to conclude your remarks as time has elapsed. If you have questions during this session, you may ask for clarification from your school board member or a school administrator after the meeting is adjourned. Thank you for coming. Do we have a motion to adopt the agenda for this evening?
So moved.
We have a motion from Mr. Rubin. Is there a second?
Second.
Second from Ms. Bynum. Any comments? Any changes? No? Good. All in favor, aye?
Aye.
Aye. Opposed, no? And so ordered. The new student liaison.
Yes, Mr. Chairman, before we introduce the new student liaison, and in January, our former student liaison passes the baton to a new liaison. So, Nova, if you would come up for us, I'm glad you're here. We would also like to recognize you for your service to the school board.
Very good, very good. Thank you very much.
Come around and sing your song. If you'd like to give a final update report for us?
Will do.
Then why don't you just start reading it?
Face this way or this way?
Wait, so you can talk to the mic so that's not
Yep, you might
If
need
you
to
just
grab
get
it.
close to it, it'd be good.
I'm mostly just here to tell you about
There you
sports
go.
events that are coming up, because that's all that's happening. So on January 13th, which is tomorrow, we have a Rappahannock versus Page basketball game. That's JV and varsity included. Quiz Bowl is happening with a meet against Stonewall on January 14th. January 15th, basketball, there is both girls and boys games versus Rchs. There's a wrestling meet on January 16th and the 19th. There's another basketball game against Madison the 20th. There's a Quiz Bowl meet versus Page on the 21st. A basketball game versus Stonewall the 22nd. A wrestling home game on the 27th. Basketball versus Eastern Rockingham on the 27th as well. There's a basketball game versus Clark on the 29th. A wrestling away game on the 30th. And there's a theater conference away at Clark on the 30th. And there's a band booster meeting on January 14th, and that's it.
Thank you, Nova.
Well done. It's good to see you in person, by the way.
Yeah,
Yeah.
no. This is my second in-person meeting, and it will be my last.
Yeah, we go. Yeah, it was still very gracious of you to be creating the videos and sending them to us, and informative and helpful. So I appreciate what you've done.
Thank you. The next student liaison, am I supposed to, do you want me to announce it or you?
Oh, do you want to? That
Sure.
would be great if you would like to.
Cassia Gaynor is my heir to the throne.
Can you get closer to the mic so everybody can hear better?
Cassia Gaynor is the heir
Cassia
to this
Gaynor.
beautiful throne up here.
That's right.
Yay, so Cassia, if you want to come up and say a few words and introduce yourself to the board, we know you pretty well, but for anyone else that might be listening, and it's without reservation that I do recommend Cassia Gaynor for our next student liaison.
Yeah, so I'm very excited to be doing this. I like to come to these meetings and be as helpful as possible. I've done a lot of leadership-based things that has had me with my grade in general, just talking to a lot of people, and I'm hoping that can lend to bringing reports to you guys that are helpful during this time. because people have different emotions about how schooling is going for them, virtual versus non-virtual, and how they're doing academically. So I hope to be able to do surveys and things for that, so I can tell you guys what they feel is working and what's not working.
Good.
Excellent.
Yeah.
Cassie, I should let you know, when I was on, Rachel Bynum, I was on the school board, I was the school board liaison in my high school, and that's the first idea that I thought I might want to serve on a school board one day. And
Well,
this is
that's
my
amazing.
nameplate that they made me when I sat with the school board in East Hampton, Connecticut, when I was your age. So you might one day sit on a school board. Wouldn't that be awesome?
Possibly, yes.
Yeah, just so you know the background. And we'll look forward to hearing what you have to say.
Okay, thank you.
Thank you
It'll
so
be
much.
nice.
Yeah, you also, yeah, so I really appreciate the idea that, whatever's going on in the school and what the students are thinking, it's good for you to communicate that to us. And there's zero fun virtual.
No, I'm not.
And they still cost the same, and we're still trying to figure that out. Anyway, welcome, and we look forward to hearing from you.
Thank you.
Thanks.
Thanks
I
so
like your
much.
bio, by the way, Kathy. Nice job.
Thank you.
Great. Moving on to donations.
Yes, I have the donations that I need to report. They're all for the SFA. So I'm just going to say that $200, Harris Hollow Foods, $250, Johnny Ray Pullen, $40, Bobby Jenkins, $50, Kim Dwyer and Bill Pullen, $80, Joyce Pullen, $20, Robert and Emily Jenkins, $50, Crystal and Lance Lind, $20, Ross and Brenda Woodward, $20, Stephen Lillard, $20, Judy Costello, $50, Sperryville Barbershop, $100, James and Crystal Jenkins, $50, and Ricky Shaw, $50.
Thank you. And we'll vote to accept donations for any consent agenda. From the December 8th meeting.
So moved.
We have a motion, Mr. Rubin. Is there a second?
Second.
Second from Ms. Bynum. Any comments? All in favor, aye?
Aye.
Aye. Opposed, no. So ordered. Mr. Grove, did you have a chance to review the bills?
I have, and everything looks to be in order.
Thank you very much. Is there a motion to approve the consent agenda, which has donations, the payment of the bills, the attendance report, and the homeschool report? Do we have a motion?
So moved.
We have a motion, Mr. Grove. Is there a second?
Second.
Second from Ms. Bynum. All in favor, aye?
Aye.
Aye. Opposed, no. It's ordered. Information items from the superintendent.
Yes, sir. Thank you very much. For the first report from the superintendent, I'm going to invite Susan Stoltzman to the podium to give you an update about the Wellness Center. Susan, I'll bring up your presentation here, and as you can see, that mic is a little further away with the podium there, so you may have to...
Can I just pick it up? Just pick it up.
Yeah, sure. Take it out. There you go.
Can you hear me?
That's better.
Okay. Okay. Hi. Happy New Year. What I'd like to do tonight is three things. I'd like to remind you where we started. I'd like to share with you what we've been working on for the past 4 months. And then I'd like to share some recommendations for moving forward. We'll start with the project overview, and then I'll share with you some of the work that we've done with the School-Based Health Alliance, and then some of the key recommendations that came out of working with the School-Based Health Alliance. And then moving forward, the next steps in terms of working with our mental health and primary care providers. I wanted to start by just reminding everybody, when Shannon initially wrote the grant to PATH, she had 4 major goals in mind, and that was to improve access to health and wellness services, to improve access to mental health interventions and behavioral services, and then to decrease chronic absenteeism, which is a new accreditation requirement. And just to remind everybody, this was a feasibility study. So the question was, does it make sense for us to have a school-based health clinic in our school community. I have a stink bug right here. I don't know what that says about my presentation. Okay, next one. So this slide just shows you how the grant monies were parceled out. And as you guys remember, Shannon identified Valley Health as a potential medical sponsor very early on, long before I came on board in February of last year. And Valley Health showed some interest, even came to look at the space that Shannon had allocated, and then COVID happened, and so that was a big pause. When I was hired, when I came on in August, Ben Dulesky, who's the Director of Operations for the Southern Region of Valley Health, reached out to me after that first board meeting, actually, and asked how Valley Health and how he specifically could help. So he agreed to participate in gathering information for the feasibility study. Shannon chose to hire School-Based Health Alliance as our consultant, and turns out that was a very, very wise choice. So the study process started with a very extensive data collection. I was primarily responsible for gathering information on the school and community data. And Ben, who is a numbers guy, he helped gather the data for the pro forma numbers. So things like salaries, operating costs, equipment, build-out costs. Go ahead, Shannon. Okay. So one of the things we did as part of the needs assessment was to survey both the parents and guardians and then the teacher and staff. As far as the parents and guardians, we got 101 responses. 44% would use the clinic regularly. 14% of respondents were uninsured. The acute health care concerns that parents had, the top were headaches, sore throats, stomach aches, colds, and fevers. But right up there with those physical concerns were a lot of concerns about anxiety and depression. And a lot of the parents, 37%, really didn't have or even know how to find a mental health provider or mental health services. As far as the teachers go, teachers and staff, we received 46 responses. Interestingly enough, in their survey, we asked if the clinic would be open to staff and teachers, would you use it? And 76 said, yes, we would. The acute care concerns that the staff and teachers mentioned were pretty much mirrored what the parents said. They also had additional concerns about mental health and ADHD. And parents also, teachers and staff also mentioned poverty and food insecurity as real concerns. So the readiness assessment, when the School-Based Health Alliance compiled all this data, they reported it in 4 major categories. Looking at locality, Rappahannock is designated as a health professional shortage area. There's a federal scale of 0 to 26. RAP is 12 in terms of primary care and 15 in terms of mental health. Obviously, a school-based health clinic would help to improve some of that access. And many of you know all this because of the grant that Shannon wrote, but 86% of students receive their health and wellness services outside of the county. The data that we collected was extensive, so I'm just going to focus on 3 areas. It definitely showed a need for primary care services. It definitely showed a need for increased access to mental health services. One of the pieces of data that figured into that was the 2019 PRIDE survey among 7th to 12th graders. And that revealed that 35% of students struggled with depression, 26% with suicidal ideation, and 45% with anxiety. And I think if we asked Kathy, our social worker, those numbers would probably be a lot higher this year. And then lastly, the pro forma cost analysis revealed a significant shortfall of revenue when compared with expenses. So go ahead, Shannon. So the recommendations were made basically in 6 areas. First of all, as far as healthcare, primary healthcare, Valley Health was seen as a very strong partner, but they're still dealing with a lot of COVID restraints. It appears that the most viable option to begin immediately is our mental health portion of the project, and I'll address that in a little bit. In terms of sustainability, in light of the pro forma numbers, it looks as if the traditional school-based health clinic, it would be difficult to sustain that over time in this school system. So the School-Based Health Alliance encourages us to explore more sustainable options. No matter what direction we went in, we'd need some additional funding. The space that Shannon had lined out was very sufficient, more than sufficient, but it added the additional dilemma of how to get the high school students safely to the elementary school, which is where the clinic would be located. And in terms of expansion, and this kind of also goes along with sustainability, there was a strong recommendation to better the numbers by expanding this idea to include more members of the community. And then, let's see, Shannon, could you back up?
Oh, sure.
Okay. I tell you what, back up one more slide. I forgot to address structure here, you guys, and this was probably my favorite thing to address tonight. In terms of the School-Based Health Alliance looking at the structure, they were so complimentary of our community. It made me very proud, very, very proud indeed to be working with the school system. They called the resources in our community tremendous, in our community and school. And the parent-teacher organization, Headwaters, after-school programs, Wonderful Wednesday, Commit to be Fit, they don't see that in a lot of schools. They saw Valley Health as a very robust partner with a strong rural health initiative and a growing use of telehealth. And then Health Connect America has strong capabilities, offers a broad number of services, and has lots of experience offering mental health care services in a school setting. So that was seen as really positive. So as far as status and next step, the first thing, go ahead, next. The first thing we'll implement with Health Connect America is to put mental health and behavioral health care services, outpatient therapy, in both schools. The only thing that's delaying things a little bit is that in order to have outpatient therapy, a facility or a campus needs to be licensed. It's not a problem, it's just going slow because of COVID. But as soon as that happens, we're ready the next day to start this. This doesn't require any build out, just a private, confidential space. HCA does their own billing for services, and they'll be able to give us special rates for students that don't have insurance coverage. And at the expressed of some interest of teachers and staff, there's a possibility for expanding this to include teachers and staff. We'll start at 1 day a week, and it will be, the therapist will be a licensed professional counselor or a licensed professional social worker in each school. So there won't be any traveling back and forth. We'll start at 1 day per week, 1 day per week, but Kathy feels that that'll ramp up very quickly. We also have Tele Psych capability. HCA has done this seamlessly. If therapists are recommending psychotropic drugs for any of the students and their parents, obviously their parents agree, we'll be able to initiate that with via telehealth with a nurse practitioner and a psychiatric nurse practitioner. And then those students would be followed quarterly via telehealth. That would require a little different setup in terms of space, but still not a great big build out or anything like that. The last thing is where we'll go with primary care. They agreed very happily and very excitedly to be our medical partner. Ben Dulesky has been the one that's been working with the hardest with us. And the suggestion was made right after Christmas, taking into context all of these recommendations, to start a telehealth pilot program in each school. So we don't have any of the details. Basically, what this would be is a telehealth station in each school where you would do a telehealth visit for the student. And we could probably start in the fall of 2021. It has a lot of advantages. It doesn't require any formal build-out. It doesn't require the kids traveling back and forth between the schools. It doesn't require a large infrastructure from Valley Health. And I think that this would be an optimum time to initiate this because of COVID and the increased comfortableness we all have with Zoom meetings and such like that. Before I open this up to questions, I want to give a shout out to our school nurses. And I want to allay some fears and confusion. First of all, the school nurses are not going anywhere. The school nurses are critical to the implementation of any school-based health clinic. They're a key referral source, they're a key triage source, and we're fortunate enough to have exemplary school nurses. Courtney and Robin have taken it upon themselves to get all the kids into the Power School, which is a computer program that will list their medications, their immunizations. It'll make it a lot easier for us to gather data as the pilot project is progressing. But one of the things I want to reassure you is even with COVID, Courtney and Robin have way too much to do. So they're not going to be involved in the telehealth visits, the visits themselves. Probably I will be, but that remains to be seen. We have to work out a lot of the details. So that's it. Are there any questions?
Yeah, so I'm sorry, I had a question regarding the telehealth versus the mental health part. Those are two separate.
Yeah. Yes. Completely different. The only telehealth part of the mental health would be if we decided to implement that, the portion that would be with medication. But no, otherwise the social workers or the licensed professional counselors would be in each school.
Okay, so those will be physical people.
Yes.
Right.
Okay.
And remember, this is something we've been trying to do for about 4
Exactly, yeah.
years, and we had 2 different agreements that we were trying to find space and how to do this. And now that we do have our own social worker and behavior interventionist, we have different dedicated spaces and referral systems that really help us hone in on those who need the outpatient. But that also presents quite a barrier when you have those referrals to outpatient services and care, and then the parents are working or they can't get the kids there. This will really help us get those kids those services they need, and just have it, it's been a barrier to travel for them. And probably less cost prohibitive too, now that we have this agreement in place with grant funding too. So, and then the physical health part, I thought that was sort of off the table with everything with COVID going on, and just, you know, I didn't know how comfortable people would be, but with the telehealth option, it seems like a perfect way to pilot it. Because the ideal situation for us, what we were saying is, you know, parents have talked to us a lot about the reasons for the chronic absenteeism, and it is, you know, we have to take off from work to make these appointments and go, and then if my child's sick, then I'm going there to the school, then to the doctor, then to the pharmacy, then back, and it takes, and if my kid has siblings, then I'm taking out 2 or 3 other kids, and then, you know, that ends up hurting attendance, academic performance, and accreditation for the school.
Right.
And if you could do that here, and we actually have diagnostic capability, if we had an actual nurse practitioner that's on the other side as a telehealth consultant saying, okay, here's the vitals, I did this strep test, and you're positive for strep, so on your way, we called in your prescription at your pharmacy, you can pick up your child, go straight home. It just saves a lot of that back and forth, and that should save us quite a bit on the chronic absenteeism, and also the convenience for the parents and a barrier to accessing those health services.
I think the other thing to mention with the mental health portion, parents usually they can't not go to a sick appointment. But with the mental health component, Kathy has a darndest time trying to facilitate going all the way into Warrenton or Culpeper or whatever for a mental health visit. So I think that'll markedly increase the number of kids who need this service and actually get it.
Yes.
So, so I'm trying to understand. I understand the psych piece and where we're sitting with that, and good work. By the way, you've been on the job for what, 4 months, maybe?
4 months.
September, 4 months. So it's good work. So I need to clarify this telehealth piece of it so that I understand better. So for me, one thing I want to make sure is I know, what's this going to cost me in FY22, and and I didn't see that. I was wondering. You talk about the partnership with Valley Health. Is Valley Health billing? Is Valley Health taking care of that?
That's
and
great.
We're facilitators of that.
Yeah, that's a great question, and that's why it's a win-win for Valley Health too, because they aren't in a position to go through what they need to do to classify the school clinic as a rural health clinic, and then to get me on board as a new employee and everything you need to do with that, and malpractice insurance and EPIC and documentation and da-da-da-da-da-da. The way that and I'll correct myself next month if I'm wrong, and Ben was going to be here, so I'm going to speak a little bit for him, but the way that I understand this would happen is, let's use a real common scenario. So an 8-year-old comes in with a sore throat and fever, and Courtney calls me and says, because she's a school nurse and she sees this all the time, I'm pretty sure this kid has strep. So we would have to have consent forms and such in place in terms of the parents would be okay to do a telehealth visit, and the parents could come to the telehealth visit at school if they wanted to. And then the way that telehealth works is there's a kind of like a facilitator who would do vital signs and take a chief complaint and sit there with the kiddo or with the patient while you made this connection with telehealth. Now the provider, they're rolling out telehealth left and right at Valley Health. So the way that I understand it from Ben, the provider on the other side of the screen would be either our designated pediatrician or nurse practitioner, or they may have a whole team of people who just do telehealth. But in any event, so you would ring your telehealth physician up, and because let's say I was the facilitator, because I'm not acting as a nurse practitioner, I'm acting as a nurse, I can't order a strep test. But these new stations, for lack of a better word, you can take a camera and look at a kiddo's throat, you can look in their ears, you can listen to their respiration, you can listen to their heartbeat, all via telehealth. So let's say the provider says, Susan, I want you to get a strep test. And I'm really lobbying Ben that we get strep tests and flu tests and COVID tests in the clinic at school. So I run this. The strep test usually takes about 5 minutes, and it's positive. So then we tell Mom it's positive. The provider says, Mom, where do you want your prescription called in? Checks on allergies, checks on weight. I would have gotten a weight on the kiddo too, especially in pediatrics, because your prescription is based on weight. And there we go.
Okay, so I see that. I appreciate you going through the scenario, because that's very helpful. So let's say that you're that person, the point person, and you're on this campus, right? So are you a Valley Health employee, or are you you're a school employee facilitating all of these situations?
Yes.
Right.
Again, a win-win.
That's really where I was headed.
Yeah.
I'm trying to make sure I understand that this is going to require someone with a nursing credential, an NP credential?
I don't know. I don't think,
But some type of nursing credential.
Yes.
an employee of the school system to facilitate telehealth pilot.
Right, right. And that person could be a nurse's aide. You just would get a little bit of a Cadillac with me on a pilot program because I'm an NP, but you don't need an NP to do that. Courtney and Robin could do a bang-up job doing that. But and that was Ben's idea. He's like, oh, well, we'll put telehealth in. And I said, well, who's going to be the facilitator? The school nurses. I said, no, that won't work.
Right.
You know, that they're too busy. But when I initially proposed this to Shannon, I said, we'll put in the PATH grant up a position to be the facilitator. And Shannon goes, no, we won't. You'll be the facilitator. So
Which we would write into the grant, which we are waiting for the next phase of our grant writing. So that's where it comes from. There is no spending of the school board budget. It would all be grant funded. The mental health piece is self-sustainable through their billing infrastructure. So there's no direct pay from us. With the medical health, there is no direct pay from the school board either. That would be completely grant funded on the next phase of the pilot after the feasibility study through PATH.
And just to address the billing, or how does the patient pay for it? Valley Health would bill their insurance.
Yeah.
Yeah, I got that.
Yeah.
That's good.
They would be able to run the Medicare or Medicaid or
Private
Blue Cross Blue
insurance
Health,
too,
yeah.
yes.
Right. That's right.
It's a great plan.
I think so. Pediatrics, I never ever thought I would champion telehealth for pediatrics. And I still would not champion it for a newborn baby, right? But I think this really could work.
Hey, you know what? The past year has changed the way we think about a lot of things.
Yeah.
And so, it could be this is more of a kind of the way things are headed anyway. So it's a really good proposal. I really appreciate you putting it together so quickly, actually, too. So, any other questions? Thank you very much. Very good information.
And if you're okay, we brought this before the steering committee for the Wellness Center, and they were very much for us trying to move ahead with the pilot to see how it works. Now remember, it's completely voluntary. We would not force any children to participate unless the parents want them to visit. We would never do that. Otherwise, the regular process, come get your kid, here's the symptoms, those sort of things. So we would not force it on anybody, but there is great interest and the possibility of grant funding to continue the work to see where it ends up. And it could really help our response, isolation, and mitigation as we continue with the pandemic, and then also moving forward with other things that are prominent in schools like strep and flu and those sort of things.
A big part of this will be education.
For sure.
Educating parents and educating staff.
Absolutely, and that's the next phase of this. We do have our planning grant funds that are still remaining after the feasibility study. The next part is educating everybody and gathering data and showing what this could be, and also marketing and all of those pieces. So
Marketing is going to be really important, so it
is.
doesn't scare
Yeah.
people.
Of course, yeah.
The whole rollout.
There was I couldn't go through all the responses from parents, but there's a lot of really good questions. Many people don't want the school nurses to go away. A lot of the parents said, man, I would use that in a heartbeat for a sore throat, but does that mean I can't see my regular pediatrician? So, all those sorts of things would need to be made clear.
Very good. Thank you very much.
So yes, we'll see how things develop and keep you posted as we move forward. But the mental health piece, we're excited. We have signed that agreement with HCA, and the licensing is pending. That should happen at any time. And I know Kathy Sickler already has stacks of referrals that we could be utilizing those services right now.
Great.
So we're thrilled about that.
During this school year. That's wonderful.
Okay, so the next item is the superintendent's report on the proposed FY22 budget from the governor. And there's a lot of pieces to that. So the state revenues, of course, we go through the same spiel every year. Standards of quality, where the state revenues funnel through. It provides program funding for specific areas. We have our incentive programs that comprise some of the state budget. Categorical funding, lottery-funded programs. And all of those, of course, are run through that lovely number that we call our local composite index, which determines how much of the locality can pay versus how much the state share should be. Now, Rappahannock County, because of our demographics, has a very high adjusted gross income, high real estate and property values, and all of that. So our demographics show Rappahannock is a more affluent county, in which case the locality, the state believes, should be able to handle about 80% of the school budget. So the locality, as far as Rappahannock County, has to have the bulk of the school budget, and the rest comes through state and federal funds. So here's our current numbers in the proposed budget. So right away with SOQ programs, we are seeing a deficit of about $98,000. Just a little bit of differences here in your incentive programs and categorical programs. I am happy to see that the Virginia Preschool Initiative, VPI funding, and the Early Childhood ED4 and MDG provider, mixed delivery grant provider add-on is in the governor's budget, which was frozen before. He did release a lot of that funding, and we have applied and successfully received a waiver for piloting 3-year-olds in the mixed delivery program at our child care center. So we are receiving additional funding to make sure we can serve all of our early childhood kiddos. I'm so happy that that's there. Lottery funded programs, again, not too much of a difference. But overall, we're losing about $9,800 in lottery funds. So starting out, here's our starting point baseline. We have to begin our budget in the hole of about $117,000 in state aid. And a lot to do with that is COVID, of course, state revenues. They have a lot of legislation that's trying to hold schools harmless for enrollment loss and ADM loss based on a lot of parents across the state going either virtual learning or homeschool. So that's why there's some provisions there. We didn't really receive any money for that because we didn't lose any of our enrollment, really. It's stabilized. So yeah, I do take a little bit of an issue with that we have been open the whole time. We didn't lose enrollment, but yet, you know, a lot of that funding was funneled to schools that did lose a lot of enrollment, so to hold them harmless in their budget. So that's your state funds. Now, federal funding makes up another big portion of our budget, where we receive projections in the previous year. And again, building this budget at this point is all conjecture, and it all changes very quickly. And by the time we build the budget in the summertime when we have to start, we have a different budget than what we started with because federal allocations change. We get actual appropriations, and then we do a supplemental appropriation with the Board of Supervisors to adjust and reconcile those things. But we do try to be very informed and make the best conjecture we can in building this. So just a little word about that. But that's why in our federal funds slide, we're just placeholding now because we haven't seen adjustments with our regular federal funds, which are your Title I special ed flow-through, Perkins, which funds your career and technical ed, your preschool, Title II, and Title III programs. Now, there is some additional federal revenue that we've experienced because of COVID. The initial infusion of those were through the CARES Act funds, which we did receive $143,000 for FY21. We also received that set-aside, the CRF set-aside of about $128,000, which helped us do our HVAC and air quality upgrades this year. And also some additional funding for Vision, Gears, and ESSER, which all fall under that big CARES Act umbrella for COVID response and relief. So that's what we received as far as our school budget. We also received quite a bit of funding from the county, which helped us reopen. We developed the reopening plan, understood that it was going to cost quite a lot to get everything we wanted to make sure everybody could remain safe. And the county really stepped up and helped us by infusing those dollars into our budget. So we were able to do that. FY22, we will have some CARES Act potentially remaining that we didn't use. We have until 2022 to spend those funds. But now there has been a huge second infusion from the Coronavirus Response and Relief Supplemental Appropriations Act, CRRSA, and that money will carry through 2023, and it's 4 times as much as we received in the first CARES Act package. DOE, we had a call this week about that, and that may be released to school divisions as early as the end of this month. You know, and I joke with my team, though, that's a lot of CARES Act response relief, but it's sort of like getting your kid something for Christmas that has everything, and you're thinking about, oh man, we did a lot of this already. So we're going to be thinking and planning very carefully in collaboration with the county to think of those one-time expenditures with this money that will, you know, take a lot of the tax burden off of us, off of the school budget capital improvement, as much as we can in the permissible
So we
funds.
can use that for CPS, or CPS?
We have some ideas of how we can use it for that, yes. So it's a little bit more flexible than the initial infusion, but you remember our collaborative use of those CARES Act funds allowed us to return $345,000 to the county in FY20 and also helped reduce that revenue shortfall by a great deal, so they didn't experience that too. I anticipate we'll have a similar effect with this, but we will be creative. We'll work in collaboration. It's probably a great topic to talk about at our joint meeting too next month. So be thinking of that. So that's great news. We do have quite a few things that we've needed to mitigate the pandemic, and it's been working very, very well, as you'll see in my next presentation. But you know, technology, we're up to date. We have BPSA funds too. We've gotten everybody one-to-one. So yes, so be thinking. So right now, again, the baseline picture, we're looking at starting at $117,000 in the hole with state revenue. You know, with federal funds that infuse that way as far as grants go, you generally don't want to use them for recurring expenses like compensation, staff compensation raises and sort of thing. I did ask the state the question about, well, you know, would it be with a 2% bonus that's being recommended by the governor right now, and if revenues make as projected or better at the state side, then he would like to push that to be a 2% across the board increase for SOQ. So we asked, would these monies be able to use for a bonus if it stays a bonus, and they're not sure yet. So still waiting on some more guidance about that. So other variables that affect our planning, health insurance, which we really won't know our official rates until March, but we did receive wonderful news that the local choice through our Anthem Blue Cross Blue Shield are doing a pool across the board reduction of 4%. So we're starting there, so that's great. General Assembly Finance Committees, the House and the Senate still have to meet as they do every year and make amendments and push and pull funds in different pots of money, and we see where that lands, and we'll recalculate this whole thing when that happens. And staff intends to return. Those will go out, I believe, by the end of this week or next week, Carol. Yeah, so those go out very soon so that we can have those projections before our next meeting where we do a little more careful planning. And that's where we find out what our staff plans to do, who's retiring, who's leaving, or who's planning to leave. So we'll get to have those factors in the budget. And then, of course, actual allocations as we get those from the state and the feds. Actual ADM and fall enrollment usually play a big part in this, not this year as far as the legislation goes now, although I do hear some, the rumor mill from up on the hill says that they may be pulling or clawing back some of that ADM fall enrollment, no loss funding because of the infusion of the federal dollars, the new federal dollars. So we'll see how that goes. And then, of course, the COVID relief funds that we talked about. So budget priorities that the administration is considering, especially like at the top of our list is the amelioration of COVID impacts, which has very many. The learning loss that we've seen, mental health supports, you know, the digital divide, equity, all these pieces are part of that. So that's going to be a big focus, and that's something that the state has really emphasized through the use of these funds, is that you really, really should be creative, innovative, and think about mitigating the learning loss that you may have experienced during COVID. Teacher staff compensation is always at the top of our list, as long as we're still lagging behind our regional schools. Our high school academies, agriculture, health sciences, are really popular, and they're really taking up, as you saw from the donations tonight. The community is very supportive of it, so we do want to call this out a little better in the budget and invest a little bit more to expand these programs, because the kids are signing up and we don't have enough slots to fill the classes, so that's a wonderful problem to have. Equity, we will continue our equity work to address those deficiencies. We have a community priorities survey that will go active this week as well, like we do each year, and it'll list all of those things pertinent to the budget and what the community sees is the most important budget priorities right now. And then next week we have our work session. So I'll ask you to be thinking and digesting all of this information. So when we come together for our work session, you can give Stacy Witt and I more direction as we go further into the budget building process. Any questions?
It'd be good if there's a board member that has some idea. It's best to kind of give Dr. Grimsley a heads up before the work session, so
Yes.
it gives her a chance to kind of be able to respond. So if you have ideas that you're particularly interested in that are going to be brought to that table, it's good to give them a heads up if we can.
Right, and if you need me to pull anything, any data or anything like that, that's very helpful, so we can bring it and have it ready for you.
Crunch the numbers.
Yes.
Is there anything right now that anybody's already got on their mind they want to share? No? Yes? No? All right, thank you.
Thank you very much. Okay, COVID-19 update. All right, this part, I will start with the reopening update so we can tell you how that's going. Let's see. I have to pull it from my drive because on BoardDocs it doesn't download all my pictures when I do it for some reason. Okay. Here we go, our reopening update for January. So I'll begin with the pandemic dashboard that we've been using each month to go through our primary indicators and secondary indicators, because according to our reopening plan, we're watching these metrics to be able to start phasing in more children to 4-day instruction. And we haven't been able to do that because our primary indicators and secondary indicators haven't been all in the green and yellow. It's basically the easiest way to simplify it and show. The issue we've had with these indicators are they're very much about community transmission and aren't necessarily indicative of what you see in your school community. In fact, they're very disparate. So we'll talk about that a little bit. But as you can see on our system, as of January 4th, we're still in the red with 2 of our primary indicators. And our secondary indicators, January 4th looks a little better for the change in cases, but we're still in the yellow for the hospital beds. Here's our overall case counts in the health district. The bottom flatter line than everybody else is Rappahannock County. So we are doing really well. We have done a good job at flattening that curve. As a result of that, we have been able to remain open for the most part. We did have, before break, we switched to distance learning to very closely monitor a very isolated outbreak in one elementary school classroom. But so far, any positive cases that have been reported have not experienced any transmission in the school to other individuals. So that shows us that our mitigation processes and protocols are working very well.
I think we're up over almost 200 now, though, aren't we?
So our hybrid remote 4-day blend model is what we are currently on. Students started back yesterday from winter break on their hybrid schedules. But before we went on break, you remember we did send out surveys and wanted parents to revisit their student schedules and let us know, do you plan to stay remote? Do you need to change from A to B? Do you want to go from remote to 4-day A, B, whatever it was. So we were able to ascertain all of that. We had 0 students that are going in person request going remote. None wanted to go remote, which is interesting because of the increase in cases around us and in the county. We did have 71 requests to switch to the 4-day instruction. Almost all of those we were able to accommodate because of changes in the schedule and because of an implementation of a new class that we have down here at the elementary. So with that new class, we were able to target K-2 at-risk students so that those students will be able to get the 4-day instruction, 2 days with their general ed teacher, and then 2 days with the reading specialist and another certified teacher. So that's kept our class sizes at the same size, capacity, but also provides those students who really need it that targeted instruction, that like we talked about last month. Also,
vaccine rollout, K-12, 1B. So we were very excited to see that the governor put educators working in a K-12 setting to the 1B tier, which is much further up the tiers that we thought. So, and we found out just today that we can start vaccinating our folks this week. So we're very thrilled about that. We have a whole sign-in process, registration process that's running through Courtney, and we're starting that process.
You're doing it at Riva?
Riva to start this week, and then it'll move to Culpeper next week.
Riva is extremely smooth.
That's what I hear.
It's a 15-minute operation, you're done.
Fantastic. So this was a map that I took before we found out that we are moving to 1B. And we've been advocating very strongly that school staff in Rappahannock be able to move up the list, since we have been in person, and we're offering in-person instruction when many of the schools in the district are not. So they're more at risk. So please give us the vaccines, and they did. So yay, we're starting that. Discussion for right now is, now that we know that we're in the Tier 1B group and we're starting those vaccinations this week, how does that affect our phase-in and our model? And some possible reopening scenarios to discuss. Do we start to transition to 4-day based on, our teacher staff vaccination window and start that K-2? Do we move 4-day all students once the teacher staff vaccination rollout is finished? Do we move, to that? Do we transition to 4-day for only K-2 according to our phase process if the pandemic dashboard metrics are met and after that vaccination window closes? We could move to 4-day for all students once the vaccination window expires if the pandemic metrics also. But to give you a timetable, March 1st is the goal to have everyone finish their second dose. So by March 1st, 1B should be safely vaccinated with their 2 doses. So after that, if you looked at March 1st as sort of your date for a potential phase-in or bring everyone to 4-day, and hybrid would go away in that sense for any group that you go 4-day. That could be a potential. Or do we just continue on hybrid throughout the semester and visit it every month to look at those, look at the dashboard until vaccines are available to the general population? So those are questions that we can discuss now, and we can revisit. Right now, the pandemic dashboard obviously doesn't promote bringing in everybody to the 4-day yet, but it's open for discussion.
What do you predict the percentage of staff that will get a vaccination?
Well, if it's any indication, I think, Courtney, we got like 30 teachers within 20 minutes that signed up. Wow. So we just released it literally just a couple hours ago. So that's a great indication that a high percentage of staff. 50?
50?
Yeah.
Okay. I would like to do it month to month. It's hard to tell with the dashboard being 2 red blocks and so forth, but I would think we would want to move towards that second vaccination date, which would be March, what was it? Is it the Madeira?
Yes,
Is that the one we're
Moderna,
getting?
yep.
Yeah, I would want to understand when the rest of the school population would also have, especially with a new variant that's more contagious. I just don't have enough data right now to understand what, if we brought everybody to 4-day, for example, would that bring it into our community spread more?
Well, and that's what the data has shown. That's why you'll start to see a lot more schools pushing to reopen and more bipartisan support for schools reopening. The data is pretty irrefutable at this point from across the world that school reopening and school in-person instruction has little to no impact on community spread. And they've already proven that over and over again. So that's why you're going to start to see that.
However, the new variant that is more contagious just showed up in Maryland yesterday. So there is more data to be collected.
Of course, as we go through this, they're learning every day.
Every day. As we can safely.
Absolutely. So those are things to watch. They do believe that the vaccine is effective against that as well.
Yeah, just depending. We don't know when.
But again, it's so early in the process, so there's a lot we don't know yet. I feel a lot better instructionally, and we'll give you that next part of the presentation too, having had moved so many into the 4-day and accommodating. The principals were wonderful, calling every single family and making sure that they had what they needed, and if not, what could we do to accommodate. So we've done really well. So I feel like we've done a good job, at least at that part, and we've captured the at-risk literacy piece that we were worried about. So I feel a lot better that way. But yes, we can revisit in February and look at, you know, how the data is improving or not and what we can do then. And I can also survey with these scenarios too and find out what the school community feels about those, which would be helpful information as well.
Yeah, I think it would be important to put the information out to the community.
Yeah.
And saying, these are the things, I know that's what this is supposed to do, but if we do it in writing,
Absolutely.
these are the things that we're looking at. We're going to look at them, you know, month to month.
Yes.
I think the more information we put out there, the better off we are.
Absolutely, and I agree, and we love our surveys, and the parents and teachers and everybody have been so great about responding and giving us that data that we need to make informed decisions, so we do appreciate that. I did want to give you a quick update about our COVID school response plan. This is a training that we gave the teachers and staff last week, but we also want to put this information out there too about how we're responding as these cases are increasing and how we respond when they are, when cases pop up in the schools. So this is pretty important. We find that people are a lot less nervous when they understand the process and how we're thinking about things, and you know, if this happens, then this happens. So that was the goal of this. So we've developed a COVID response logic model. So it's scenario based. And this is how we make our dynamic decisions based on these scenarios. So let's take the case that we have a single positive case scenario. We've had a couple of these pop up already. So in a single positive case with no exposure, that positive individual will quarantine for 10 days after symptom onset, like we have. There wouldn't have to be a school closure because there hasn't been any exposure at anybody at school, but we would still send our COVID notice out. We've been very diligent about making sure we're transparent and notifying everybody if a student or staff member is positive. Let's say we have a single positive case in a primary classroom. So at this point, this is where we would put that class on an automatic 10-day quarantine. We found in dealing with our outbreak last semester that it's impossible to really discern the amount of exposure that can happen with that age group. Just because as hard as the teachers try and as great as the kids are complying, it's just a little bit more difficult. So the notification would be sent to those families that we are putting your class on a 10-day quarantine because there's a positive individual in that class. And we'd also send a COVID notice.
With distance learning.
Yes, distance learning, sorry. Of course, distance learning is provided in any of these scenarios.
Right.
Single positive case when we have known exposure, and this is a big piece of why we're doing this. Schools are now being very highly encouraged to take on contact tracing at the local level, which we are very appreciative of because we can't always, when we're trying to make these macro decisions, you can't always wait for the Department of Health to get back to you and those phone calls and the contact tracers and things, so you're losing valuable time. So they've empowered the schools now that we have trained staff. Our nurses, as you heard Mrs. Stoltzman say earlier, are phenomenal, and they have done a wonderful job and are very, very well versed and trained in the VDH protocols and the contact tracing protocols. So they know the system, and we know our people better. So we have, you know, more grassroots observational data we can bring to the table. We've empowered the staff to work with us. Now, with this kind of a system, they may be privy to additional information, but confidentiality is still of utmost importance, and we hope that now that people understand the process a little better, that will help contain that too. So single positive case exposure, a local contact tracing will take place. Exposed individuals are asked to quarantine for 10 days as long as they have no symptoms and present a negative COVID test within that 48 hours at the end of the quarantine period. Otherwise, if that negative test isn't provided within that 48 hours of the 10-day, the 14-day has to be followed, and that's according to VDH guidelines. If it's a single case with limited exposure, you wouldn't anticipate a closure of school, okay? But if let's say we get a call at 6:30 in the evening, and you know, it's going to take some time to call everybody, and poor Courtney, you know, doesn't want to be calling people until midnight, 1 o'clock in the morning. So she may call me and say, I need a day. So I may have to switch onto a distance learning day so we can make sure we're very thorough and get our contact tracing done. And we've sent out multiple notices to parents at this point. Look, this can change at a moment's notice and we may have to switch to a distance learning day. So please have plans that anything could change. So have plans for your children to have a distance learning day or be at home in a moment's notice. So it could be one day, could be a few days, depending on the amount of exposure that's anticipated. So that's for your single cases. Multiple positive case scenarios. Let's say we have one or more positive cases that are unrelated. You know, one in 2nd grade and we've got one in 10th grade. They're not siblings, not related. It's not necessarily an outbreak because they're not interrelated. So we'll deal with that just as we would single positive cases in those buildings. You would not anticipate closure of the schools. If that case is a primary class, we'll follow the primary class closure with distance learning, automatic quarantine, and a COVID notice would be sent. If we have an outbreak, which is it's two related positive cases. So if they're interrelated, then that's considered an outbreak. So if it's limited to a particular class, we will quarantine that class and use the quarantine procedures. If it's limited to a particular classroom, then you may not see a whole school or district closure. However, if it's not contained to a single classroom, then you can anticipate that we might close down a building for 2 weeks to monitor and watch the full quarantine period and just make sure we can hone in on those cases. Okay. The notification will be sent to families and, of course, the COVID notice out. Now let's say we have multiple outbreaks, 2 or more interrelated cases. If it's localized to a single building, that building would switch to the 2 weeks on distance learning to monitor. If it's in both schools, then of course that would be division-wide. And of course we would notify families using the process we have so far. So a little bit about local contact tracing and how that will work. I will ask Courtney to lead this part of the discussion if you'd like to come up to the podium. It is.
You probably need to hold that.
Yeah.
All right, can you hear me?
Yes.
All right. So because Dr. Rensley talked about earlier, the VDH is really backlogged at the moment, so they want schools to start their own contact tracing, and it's only prudent because then we can stop the spread more quickly. Robin and myself have been trained in the contact tracing, so we feel very comfortable. We also have a good liaison with the Virginia Department of Health, Kathy, and she will assist us whenever we need it. So we feel like we have a good handle on how to do the contact tracing and get things stopped and the spread slowed as quickly as possible. So the first step is that we will interview the staff member or the student family that reports the positive test to the school. That is to be reported to the school nurse. So Robin is covering the elementary school and I'm covering the high school and the central office. So they are to report to us directly. Then we will interview the positive person or the family and identify as many immediate close contacts as we can. Yes?
Question. Would VDH, would they contact you if there's a positive test as well? Do we have to rely on staff member, student, or family to report a positive test?
If we want to start the internal investigation, yes, because VDH, that's the problem. They're backlogged. So a person can go to a testing site and get tested, but VDH may not call them until almost a week later, we've seen. So we need them to report to us.
The testing site would not report to you?
They report to VDH.
Okay, okay.
Mm-hmm.
That's a link that's not covered, right?
Well, the problem with the testing center reporting is that they'd have to report to
VDH.
They have to report to VDH to start the tracing process, whereas they can't take time to call the employer and where this person has been every single place. So they start with VDH and they make all the phone calls.
Okay.
So once we are contacted by a positive person, Robin and I will start to identify as many immediate close contacts as possible. We will get to those people first to quarantine them and go over their procedures with them. And we will also contact our VDH liaison. Then the internal investigation begins. We will start to interview teachers, support staff, and look at the seating charts to look at the student and staff proximity. And then we'll continue to collaborate based on what we find in localities of where people were in the building or in classrooms. And then we'll determine the result of the investigation. Of course, we should have already contacted the close contacts, and then student and staff will be notified of any classroom quarantines or instruction changes. We'll be talking with Dr. Grimsley closely to see if we need to take some time for the investigation and close school or go to distance learning for just a 24 to 48 hour period. And then, of course, if VDH determines anything further than what Robin and I have determined, then we will definitely follow their guidelines.
And I will mention, VDH has been, our local liaison and health population control coordinator have been great about getting back to us anytime we have a question. And these ladies, Courtney and Robin, have been outstanding. And in just about every case, they were much more thorough than even VDH would have said to be. So they've caught things that they would have never picked up on. So we've been much safer, I think, in these ladies' hands, thank goodness. So it's a good collaboration. They've been very complimentary.
Yes, I am so thankful for Robin. The beginning of the year was slightly stressful, so thank you. And then we'll talk about our illness guidelines. So we have to understand that during an exposure, I just want to make note that there's a difference between symptomatic and asymptomatic when you have an exposure. So when we talk about some of these things, it's important to note that whether you have symptoms after exposure or you do not. Okay, so there's a difference there. We do have, so we're going to just talk about symptoms right now. If I have a child or Robin has a child or a staff member that presents with COVID symptoms, we will look at the list of symptoms. We will then look at the risk of exposure, such as, how close was this person to a positive person, or if they have a known contact at home and they came to school anyway, we need to know about that. So that'll be in the interview process. And then we'll look at our community transmission and where we are on the pandemic dashboard. So if we have someone that presents with symptoms and we are in a low community transmission risk, which is not where we are at this point, and there's no exposure noted, then we will go by the normal school guidelines of you can return to school after you're fever-free for 24 hours without the use of fever-reducing medication and your symptoms have improved. Once again, this is no exposure noted. There's a low community transmission risk. If we have a person with symptoms, still no exposure, but yet we're in a moderate or higher community transmission, and this is where we find ourselves at the moment. So they are automatically to stay home for 10 days from symptom onset unless they do some of the following. They can report with a negative COVID test after day 8 of their quarantine, and they can return to school or work as long as their symptoms have improved and there's no fever for 24 hours and they have that negative test. So all of those things have to happen. And if they have a positive COVID test, it's an automatic 10-day quarantine from the onset of symptoms, or the positive test if they were asymptomatic. You can return with an alternate diagnosis. So if you have a student that goes to the physician, we know that there's many childhood diseases that mimic COVID. And so if they go to their physician and return with an alternate diagnosis, they can return to school sooner. So symptoms present, and you do have a known exposure, there's automatic 10 days for sure. But with symptoms, we're going to do the full 14. So if they're symptomatic, they have to maintain quarantine for 14 days after their exposure. So Robin and Dr. Grimsley, I think, found this little cheat sheet here of what we talk about with exposures, household contacts and non-household contacts. And it gets tricky when you live with someone and you can't quarantine from them. So we have to then go by different guidelines because it's actually, your quarantine begins after your last contact with that positive person. So if we have someone that can't be away, such as a child, you have to care for a child, or a or spouse or something like that, and you can't be away, then your quarantine will extend because you will have to wait until their quarantine is up and then you can begin yours. So it becomes a little tricky when people can't quarantine, but then if you can, then we follow all the guidelines that I just discussed. Did you want to add anything?
Any questions about this process?
Yeah. Would it benefit us at all to become kind of a mini test center?
They haven't released testing to, I don't think Virginia
I don't
schools.
know it's possible.
I mean, I don't know. I mean, that's one of the things we discussed with the Wellness Center is a possibility of that diagnostic.
I mean, it's nothing to give a test. It's a matter of.
There is some legislation pending that may go to the floor at the federal level about that, and pushing for accessibility of tests, at least in the community, and maybe to K-12 sites. For us, if we were to, as we roll out this pilot, we might have that capability. But for now, we do have testing centers located near us, and we're using.
Near being Culpeper or Warren.
Yes, yeah.
What I'm saying is there a possibility for people in Rappahannock not to have to leave Rappahannock to get tested.
At this point, we haven't had any luck requesting that, even just for school employees for certain clinics and things, and they don't have the bandwidth and capability right now. And it's not really highly recommended either. They don't want people testing right now unless they have exposure or symptoms.
Well, yeah, if they have exposure and symptoms, then you can get tested quickly, and you can start this whole process sooner, one would think.
Yep, but we have put in some places, I know you can go get what's it called, the test that takes longer.
PCR.
PCR test. At your doctor's office, that one takes a little longer, and your insurance will generally cover it, especially for us. But the rapid test, we are picking up the cost for employees that are in an exposure period if they feel the need to go get tested. So we have special funding to be able to use for that, COVID-related. So that helps. But so far, no luck with that. But it could happen. It might be a possibility. It just depends on the health district and what they're able to get out.
Something to consider, I would think.
Any other questions?
I just had a question about the quarantine process a little bit more. So most of us live together with our families in a fairly open house, and does that affect like a parent going to work and that set of when is a child considered quarantined if they're sitting in their room and everybody else is doing their regular thing? Or
There are ways to self-quarantine within the home, and that would be something I could instruct people on if they were indeed in that situation. Now, if you have a positive person in your home, an actual positive COVID person, you can isolate, and there's ways to do that in your own home. But if you have like your child came to school or you went to work and you were exposed at work and you're an exposed person, you don't necessarily have to isolate. You should use precaution of not to use shared items and things like that with your family if you've been exposed. But not necessarily if you've been exposed at work, your child can still come to school.
Okay.
Yeah, and as an exposure. What we really need to look at is tracing off of the positive person instead of exposed.
Okay. Thank you. It's very carefully rendered. You've done a good job. I really appreciate it.
A lot of reading. A lot of reading.
Yes.
Yes. Okay.
Thank you. Thank you very much.
Wonderful.
Great. It's been our experience that as people are more educated about the process, and we've seen it work. Like I said, this isn't something very new, but now we have the empowerment and the authorization from VDH to go ahead and do this. So we're thrilled to be able to do that. All right, next up is academic progress. So I'll share a little bit about that. As you know, this has been a topic of great concern across the country as we've seen, deficits in academic progress, in learning, digital divide, all of those pieces play into academic progress of students. So for us, the research is showing that we've seen learning and development having been interrupted and disrupted for so long, have seen opportunity gaps greatly exacerbated, especially for low-income students, especially in rural areas. that don't have the broadband access and community resources that more urban areas do. And that's a question we get a lot, you know, in comparison to a lot of the Northern Virginia, more urban areas that have been able to sustain distance learning and maybe not experience as much learning loss. But they have a lot more resources and a lot more bandwidth, more broadband and all of those pieces. For us, our kids are greatly at risk when we can't provide that type of those resources.
I'm not sure they're doing so well anyway, so it doesn't matter.
Yeah, that's what data is coming out to show, that
Yeah.
even the distance learning model, no matter how great the resources are to provide them, isn't, you know, as effective as in person right now. We need more time to develop that and train and come up with blended learning, but we had 4 weeks to do that. So, that's the truth. So yes, we've seen that. It's also exacerbated the limitations of standardized tests, which reward this narrow set of skills and more affluent students. So that's what we watch for in the research. So recommendations: schools urgently need resources and relief in order to provide effective remote learning. Access. You need to invest in extra supports, interventions, and resources to ameliorate the gaps created during the pandemic, which is one of our top budget priorities this year in planning. And we have to rebuild and redesign conventional systems to incorporate and integrate these cognitive development issues along with the socio-emotional toll that it's taking. So it's a much bigger, more complex picture than just, you know, here's the content digested test. You know, which school is more complex than that anyway, not to oversimplify. But federal and state mandates are changing too, to account for some of this. So we've seen accreditation waived for the state of Virginia schools for this school year, and there's talk that it will likely be waived for next year as well. The SOLs required for federal accountability have not yet been waived. So they still have those reading and math standardized test provisions and graduation requirements. There has been some new flexibility for testing conditions, expedited retake, score ranges, and local performance assessments that we can now use to capture a more accurate picture of mastery rather than just a one-stop shop standardized testing conditions under the old way. And then we've also had financial resources that are provided through our federal funding. So what we've seen, what we've learned first semester, students, parents, teachers have all experienced significant challenges adjusting to remote learning, even with our partial in-person model. First quarter grade reports showed that we had a significant number of students failing one or more courses, which is consistent across the state and the nation because of missing content. Teachers were reporting difficulties engaging students remotely. Parents were reporting difficulty interfacing with Canvas and new systems that they now had to navigate. Students reported struggling with the independent learning. All of a sudden, we all just expected adolescents to become very highly self-motivated, independent learners, which, guess what? No, that's not how it works. And their social emotional impacts became much more significant as this progressed. So after we really honed in with a microscope examining those quarter one grades, it was really clear that failing grades were not due to what students knew and understand and could grasp, but what we were doing on our conventional grading system was grading distance learning behavior, not mastery of content. So it became very clear that these old procedures were not going to capture what our students know and understand, which is vital for us to be able to diagnose and provide intervention and proper instruction and pacing. So that's a really critical piece that we need to understand. And administration identified the need for additional student, family, and teacher supports so we could enhance that academic progress and improve social emotional outcomes. Because it wasn't just the part of the puzzle that was our students that were, you know, struggling, or our teachers. They provide wonderful instruction. It's just all of these pieces together were a huge conglomeration of complexity that led to us realizing, wow, okay, something's got to change, and we need to work together to change this so we can better understand the picture and provide supports to the students and the families that really need it. So what we did was modify quarter one. With any change, and this is regular implementation theory, it takes a while to get your sea legs, so to speak, to understand the new process and integrate and implement changes. So we gave additional time for quarter one. We realized, okay, people are finally at the end of quarter one getting the hang of all of these platforms and how the schedule works. So by this time, they were getting more competent. So giving that extra time to turn in without penalty was really advantageous. We used an incomplete versus the F. We found also in an independent learning setting that when you automatically give that F on a report card, it really is just disenfranchising for the student. And the parents were reporting like, I feel like a failure. I'm supposed to be supporting my, so it's just a really negative impact.
Well, if you give an F, it's over.
It's done. And how do I recover from that when I have 4 missing assignments because I thought I pushed the button and it went off in the cloud and then I did this and I know the content, but I'm failing. I'm a failure. And it's just this bad effect. So we use the incomplete to say, okay, you're just not done yet. We'll work through this stuff and see where you end up. We added in supports like the Wednesday school, Saturday study hall, the extra time, and individualized support throughout Q2 to be sure that those students could make those gains. We gave additional resources and targeted intervention systems that we were able to use. And then we also implemented a social emotional learning curriculum to deal with some of these heavier issues, stress and anxiety and things our students were experiencing. So key implementations at RCES, we had additional daily remediation time with instruction provided by exploratory teachers, specialized training for intervention teachers provided by the reading specialist, PALS quick checks assessments were given, and that's the assessment we use to gauge progress in reading and phonological awareness. 78% of students in K-2 are making adequate progress in literacy. So that's wonderful. We're not seeing the decline as much as we thought because of these interventions. And then with the implementation of our new primary promises class for those students who are lagging a little bit or struggling with literacy, we anticipate that to come way up very quickly. Our SOLs are still going to have to be given for those federally required classes for the federal accountability piece. So that's your reading, math, and civics. And then we have the option to give a performance-based assessment in Virginia Studies. And we want to do that, especially in that 4th grade year where you're giving a math and reading assessment. And then you also have Virginia Studies, which is a very content-rich, vocabulary-rich class that's really tough on a remote learning to really gauge their understanding. Plus, it's just heavy. That's a heavy, heavy load in this environment to take all of that. So we're worried about the social emotional impact on students too. It's a lot more fun to show what they learn in something like Virginia Studies on project-based and performance assessments. So we're excited to be able to do that.
We always said that if you had Virginia Studies, you had U.S. history.
Oh, absolutely.
Same thing.
Yeah. So the primary promises class, this is a new class that we're funding with CARES funds. It will serve an additional 20 students for 4-day instruction that need some more literacy support. Again, 2 days spent with primary teacher, 2 days with the primary promise teachers who are certified teachers, Stephanie Beard and Catherine Todd, who's our reading specialist. So that's specialized time that they get with those very qualified teachers.
And that's all day?
All day, yep. So understanding SOLs at RCHS. So we have, the DOE has given us flexibility at the high school to award local verified credit under certain circumstances. And that depends on the initial score range. Previously, the score range was 400 or above for passing and a 375 or above to qualify for an expedited retake. And they've pushed that a little bit to be between 350 and the 400 to either qualify for expedited retake or become eligible for the locally awarded verified credit, which carries with it some weight too. You have to show mastery just in a different way, maybe not on the test. And it does have to be quantified and scored by your local committee according to policy. And you still have to pass the class and make sure you can earn the credit. So there's some flexibility there that we can build in. So here's our fall testing outcomes. If you look at the left, that's on the typical system. Still not horrible, honestly, for what we've seen. Now, some of those courses like geometry, earth science, world history 2, those tests are usually only taken by students who really struggle to pass SOLs anyway, because they don't need them after the 8th or 9th grade when they've gotten those verified credits. Under the new system, remember how they've repealed a lot of those SOLs. So typically, and schools struggle with this a lot, is those advanced classes in your second tiers, the kids don't need to take the SOLs. They may be taking the class, but now your best test takers are out of your test taking pool. So what happens? That's what you see. Now with the current flexibility, you add that in with the locally awarded verified credit flexibility, that the rate at which students qualified for the 350 or above, and then look at our percent tester success rate now. It's a wonderful formula. Mr. Swindler, I don't know if you wanted to add anything about your school and teachers and how this was working out, but sure. But we were thrilled with these results because enough students at least qualified for the 350 or above, and that's still tough to get. That's only a couple of questions off of passing in some instances.
Yeah, the first thing I'd say is if you look at that on the right, which is what the state looks at, because they're the ones that, they change the limits, that to me is astounding. I felt like our students would do well, but to see 100% almost across the board is unbelievable. And then even if you do look over on the left, and as Dr. Grimsley said, there's still an awful lot of bright spots, especially when you consider the environment in which this happened. But one of the things that we noticed was many of our kids who did not quite get 400, okay, they did get between 375 and 400, which means that in normal circumstances, they would have been able to retake that test. And we historically run at about a 50% success rate with our expedited retakes. So without putting a whole bunch of other numbers up there, which I'm not going to do, bottom line is I personally was thrilled with this. I was thrilled with my teachers and I was thrilled with my students. I expected to see good things. I kept telling her that. I wasn't sure she believed me, but I was astounded by this. And I don't know that we will see how other schools did. A lot of schools, most schools are on a block schedule. Their semester, for instance, my bride works for Stafford County. They're getting ready to do, they're on a block schedule, but they run their semester for the fall through about the middle of January. So they're getting ready to test. I'm going to be very interested to see how we compare to some of these other schools because I've been I was just very pleased with these. Some of the other things that Dr. Grimsley mentioned earlier, the number of failures, none of that made any of us happy. Please understand that. And we're thrilled to have those new programs. The Wednesday remediation is huge, something that we're going to start earlier this year. We're looking to start that right after we send home our first interim grade report around the beginning of February. The other thing I've noticed this semester, it appears to me that our number of remote students is going down, and that is a huge plus. Because what I found with remote students, either they did really well or they did abysmal. There was no in between. And the more of those kids that we can get even just for 2 days a week, the better. But I mean, if anybody got any questions about these, I'll be happy to spend as much nerd time up here as you need to answer them. I have become, Crystal Smith has converted me to an SOL nerd. And, like I said, I'm very proud of this. Not proud of me. I'm proud of my teachers and I'm proud of my students and I'm proud of the support that our community has given our schools so that we could put up numbers like this in what I consider to be, as I said in an email to a parent today, I feel like we've gotten through the darkest days of COVID and it's only going to be a little, like the days are getting longer, they're getting brighter too.
Let's hope. What was the response for your Saturday program?
The response for the Saturday was not as high as it was for the Wednesday remediation. Danny Pong typically ran, she was there for the Saturdays. To be honest, there were a couple Saturdays where I know she probably didn't have more than a handful, but I also know there were Saturdays where she had a dozen or more. So to me, that's worthwhile. I mean, the Wednesday remediation was probably the most successful program that we ran. In the elementary school, on any given Wednesday, they had probably twice the number of kids that we had, and I was thrilled. So I'm really looking forward to continuing with the Wednesday remediation. Got to remember, we didn't start that Wednesday remediation until what, like November?
Yeah.
Yeah, I mean, it was late, and now we're going to be starting it, I'm looking at the first, at the latest, the second week of February.
Is that a financial issue?
Not with CARES funding, no.
Right.
We can use CARES funding
Yep.
for that.
That's
Yep.
what we're using our local
So
CARES funding
we could
for.
start that right away.
Yeah, well, what we're doing is we're waiting, which it's not long of a wait, but our first, January the 28th and February the 1st is when the first interim grade report goes home for quarter 3. So we're timing it to take place right after we have those grades, so we can identify who needs to be there.
But there's no way to require somebody to be there.
Well, not yet. It's just, I hate to say this, I wish there were a way that we could require some parents who request remote learning 100% to not do it. And I mean, I got one today, and I talked to the mom, and I was like, do you really think this is the best thing? But I can't, right now we can't. But I will say that for the most part, for the Wednesday remediation in particular, the response has been pretty positive.
Are we providing buses for that?
Yep.
For Saturday as well?
Not for Saturday, no, sir. Saturday is you show up at the high school in the Commons, and basically Saturday is just a place to use our internet.
It's a study hall.
Precisely, whereas the
Why
Wednesday
not run a bus?
Wednesday remediation, however, is, we have teachers. We try to keep the number 6 or less per teacher so that not only are they there, can use our internet, but they've got people there. And I try to have all of the core subjects. I don't try to, we did have all of the core subjects represented to include special education, and it worked out really well. And again, thanks to Dr. Grimsley and the support of that, because we couldn't have done it without that support.
Yeah.
And your support.
Yeah, absolutely.
Anything else?
No, I think it's great.
That's great, Jimmy. Thanks. Thanks.
So this school system, everyone, the community is very committed to student success on every level. Where the wonderful Wednesday day camp will continue second semester, and we were just notified last week that we did receive full funding from the Path Foundation of the $69,000 to run it throughout the spring. So that's going to be a different grant, no CARES money or local money for that. Slots in Verdun School Day Camp will continue. I will use CARES. I've also applied for a Northern Piedmont Community Assistance Grant to cover some of those slots too and offer additional if we need them. Wednesday school, Saturday study hall will continue those. Additional enrichment opportunities are in the works. And we will be discussing very soon, because it'll be here before you know it, enhanced summer programming that will be offered this summer. So we're excited about some of the conversations we're already dabbling with right now about how that will look for our kids. And also the winter intersession, we forgot to mention, but that happened too over winter break to really capture those juniors and seniors who were on the brink of losing credit for verified credit. So that was very successful too.
Great.
So thank you for everything. We will persevere. We will succeed because we are Rappahannock.
Thank you very much.
Thank you.
Any questions? No? Thank you, Dr. Grizzly.
You're welcome.
Moving on to Headwaters representative. Do we have anything that happened since the last meeting?
Well, it's just some upcoming programs that are happening. So yeah, Headwaters for this this winter is collaborating with Rchs to start organizing enrichment pods for students. And the first one that will be offered is going to be a drama club for 10 students. I'm so excited it's happening at the elementary school. And it'll start probably the first week of February. They'll be following all the protocols that we follow in school. And people who've run plays that a lot of the kids from our schools have been in are going to be leading these programs. Patty Hardy and Bob Hurley among them. Headwaters is going to do all the footwork, the organization, marketing, and cover the cleaning costs of the program, and Rchs will lead the programs. So that's an exciting thing that's been in the works. Looking for more enrichment pods to start up as the weather gets warmer and as we hopefully get to feeling safer. Things like other arts programs, maybe pottery, mosaic making, or writing classes. And then the Headwaters is also working closely with the principal at this school to try to start up after-school programs, hopefully February also. And they're also in preliminary planning for the summer chorus program to offer a 2-week chorus, maybe June or July, late June or early July. The other thing that I wanted to make sure people know about is the Starfish Mentoring will be seeking some short-term mentors for the next 6 months to match up with students who need some extra support in this pandemic time. And there's a 1-hour informational meeting that is going to be held on Zoom on Wednesday, January 13th at 7. Hopefully, and it'll be Brittany Dwyer running these trainings, and you can contact the Headwaters office or Brittany to register for that. So it's looking for.
That's tomorrow night.
That is tomorrow evening at 7. Yeah, so you can still register, I assume. So registration is still open for anyone who's interested in helping out some kids who could use a friend. And that is.
As a board, and we'll be voting on that during action items. And the statement of economic interests are due before February 1st, right, to our clerk. If you haven't accomplished that yet, make sure that gets done. Any comments or questions about that? Anybody? Okay, moving on to public comment. If you want to address the board, you'll see in the agenda there's two sections of that. One is public comment, which would be, and the second has to do with the budget. So anything that someone wants to share tonight with the board that's not related to budget, we'll do that first. So is there anyone who would like to address the board this evening? On any topic other than budget? No? Okay, moving on. Is there anybody want to address the board this evening? Anybody else? Yes, sir. You may need to grab the mic, Mr. Cunningham.
I found it a little difficult to hear everybody, so I suspect you may not be able to hear me too well. My name is Richard Cunningham.
Hey, can you hold on a second? Can you hear Mr. Cunningham?
Can you hear me now? All right.
That's great. I should have checked that earlier, right? Sorry.
Okay. My name is Richard Cunningham. I live in Amosville, the Jackson district. And I appreciate the opportunity to speak with you all, and I understand that you're going through very trying times dealing with this COVID situation in the schools. The subject that I want to address is a piece of the budget. I had an opportunity to see the draft budget, and I was focused on the electricity use on an annual basis, looking at it vis-a-vis PV solar energy. So the school budgets for electricity projected for 2021 provide some interesting insights. I'd also like to point out I had a copy of a draft. It may not be accurate, but this is what I saw. The total school budget for fiscal year 2020-21 is $13 million. The electricity budget is $170,000, minor compared to 1.3% of the overall budget. Well, what stands out? The 2019 and 20 electric budget is 17% lower than 2018-19. Is this decrease due to COVID-19 restrictions and/or active conservation measures? According to national data of K through 12 schools, the average electricity load is 10 kilowatt hours per square foot per year. If we take the current projected budget, $170,000, and work it out on a square foot basis, that comes out to 11.3 kilowatt hours per square foot per year. Slightly higher than the national average. However, that's the low figure based on COVID. If we run the numbers at 204,000, which was the previous energy budget, actual 2018-19 cost, we get 13.6 kilowatt hours square foot per year. This is based on 150,000 square foot calculated for both schools. So it appears that Rappahannock County is using more electricity than the national average. Rapp County Schools was recognized as with an award from the National Green Ribbons schools. And this begs the question, whether the conservation guidelines can be implemented. Also, in looking at the budgets, in addition to electricity costs, there are separate budgets for propane fuel and substantial funds for building service maintenance. So, based on Rappahannock electric utility rate, the school rate is 10% or 10 cents versus 12 cents for residential. The total electricity budget for 2021, 1,700,000 kilowatt hours. Excuse me for all these numbers, I'll try to summarize. So how does PV solar compare to this load? What percent of the electric could PV solar systems provide? The school roofs can each reasonably accommodate 200 kilowatt PV systems, and the parking areas can accommodate 100 plus kilowatt parking canopy systems. You've probably seen these shade canopies with PV panels on them. Therefore, the schools can accommodate approximately 600 kilowatt hours PV solar. Now, I'll leave these feasibility reports with you, but this is the grade school, and this is the high school. The roof surfaces, pretty much ideal exposure for solar electric. So we can, if we take a base of 600 kilowatt, a system sized for 600 kilowatts, roughly that's looking at maybe 15 or 1,600 solar panels. Using the NREL PV watts calculator, 600 kilowatts PV yield 836,000 kilowatt hours per year, and we're paying 10 cents per kilowatt hour, so that's $83,000 a year. And I don't know if you all have a copy, but I gave you a copy of this.
Yeah, we do. Yeah, thank you.
Good. So what I'm looking at, you put 1,600 premium PV panels up, and you get a return of, say, $85,000 a year. And the argument going forward is that the cost of PV solar can be paid from savings. So you can literally finance 100% of the costs and pay back the loan from savings over 15 years or whatever the rate would be. So where does the funding come from, and how is the loan secured? Are grants available? What about bonds? These are questions better answered by others. Remember, this can be done with no upfront costs involved. This is a strong investment strategy for our collective future. In addition to financial advantages, benefits can accrue from education and the environment. Rappahannock County Electric Co-op is actively promoting grid-tied PV solar. So we can reach out to REC for support and conservation guidelines. My thought, if the federal government is promoting renewable energy stimulus plan, they should be in a position to secure the loans. Write your congressman to make the case. I propose that Rappahannock County School Board take up the issue to investigate feasibility of PV solar electricity, prepare requests for proposals, and solicit bids from qualified PV contractors. I would also just like to stress here that paid from savings is real. It's a real concept. And well, the money is available. If you can get a loan, the bank's going to want interest. Work through the numbers. If you paid the loan off at the rate you were paying the electricity, in 12 years, 13 years, the loan would be paid off. You have another 15 years of virtually free electricity.
Thank you. Yep.
This This is a long-term investment.
And thank you, Mr. Cunningham. And we had investigated this 3 years ago.
3 years.
I remember 3?
3 years ago, yeah.
And so it's probably time to revisit the issue. And so one of the things I was thinking about, thank you very much. One of the things I was thinking about with this, when you were speaking, Dr. Grimsley, is this idea, thank you very much.
Okay, sure, we'll hand it to, give it to
So
Ms. Bolt.
in the idea of mitigating learning loss, that type of thinking, this is not just and we're repeating things that we said 3 years ago.
Sure, yeah.
That it's not simply about electricity, right? It's a platform to teach young people about sustainable energy, or you know, I want to implement this off the grid solution for my home, and I learned how to do it while I was at Rappahannock County school system. So
It's the fastest growing area of energy right now. It's true.
And so there are benefits greater than just the financial ones, I think, and it's time probably to revisit it. It's a good time to be talking about it when we're heading into the cycle. I would think it'd be prudent for us as a board to ask administration to take a look, revisit it, and let's look at the possibility of implementing again. We ran into problems last time related to, you know, we're going to have to cut down trees, we're going to have to, you know, and we probably can dig up where we were at, what the pros and cons were, and just revisit those. And
yeah, and I believe that these pages that you gave us, Mr. Cunningham, are sort of models not to completely offset our electricity use. I think last time, 3 years ago, we had asked Sun Tribe and another company to offset completely, and we would have entered a contract that we weren't completely
about that contract, right?
Yeah, and I think that yeah.
Where you're using to put panels only meet about 50% of your electric load.
Right.
To go 100%. Yeah, that's right.
Right.
Yeah, but this might be something to where we wouldn't be looking for, we would put out an RFP based on the specific plan, get the bids,
Right.
and maybe we could work out something to where our payments on a loan would be equivalent to what our cost in power is, and we could instead get solar panels and all the benefits that Mr. Mills outlined.
Well, it might be.
One would think that you'd have to have a whole engineering study to get that,
Yeah,
information.
that's
Right.
That,
I mean,
that's his expertise.
These are good starting documents that we could at least give to Dr. Grimsley and Dr. Bolt to get started.
Yes,
on
and
revisiting that.
it would probably be a good idea too to maybe bring in the county with the discussion at the joint meeting
Right.
to see how we can
Right.
pool and leverage resources, because they have additional funding resources with REC and other pieces that we may be able to collaborate, and
That would
they're
be
doing their
wonderful.
building committee too. So there may be opportunities to collaborate where we can't do it alone, but maybe there's a way
Right.
together we could accomplish more.
Yep. It's good timing.
Maybe I've missed it some. What is PV solar?
It's photovoltaic?
Photovoltaic.
Say it again?
Photovoltaic. It's a type of solar panel from, photo is light,
Okay,
voltaic
I have to go back to
voltage.
school.
Yeah. Yeah.
We should surrender these.
I will give these to Shannon, or I'll give these to you.
We'll give
Yeah.
these to you. So
Yeah,
Okay,
There you go.
thank you.
All right, is there anyone else this evening
yeah, thank you.
who would like to address the board? Anybody? Last call. All right, moving on, entertain a motion to approve the 2021 meeting calendar. We have a motion, Mr. Grove. Is there a second? Second from Mr. Uven. Any discussion? All in favor, aye? Aye. Opposed, no. And so ordered. Approval of the new student liaison, Cassie, I don't remember her last name.
Gainer.
Gaynor? Cassie Gaynor. Do we have a motion to approve? We have a motion, Mr. Uben. Do we have a second?
Second.
Second from Ms. Bynum. Did I hear you? Yes. All in favor, aye?
Aye.
Aye. And opposed? I hear none.
How about that?
Congratulations.
And the motion carries. Welcome to the team, Cassie. And motion to approve the VSBA Code of Conduct for signature.
So moved.
We have a motion, Mr. Groves, is there a second?
Second.
Second from Ms. Bynum, all in favor, aye.
Aye.
Aye. Opposed, no. So order, our next regular meeting is on February the 9th at 6:30 in this place, a joint meeting of two boards. You're going to see both boards come together, have a introductory. It's going to be, chaotic because two boards have to open and all of that. And we will discuss the things that we have in common at the end of about halfway through that meeting. The supervisors will adjourn and leave, and then we will conclude the school board meeting at that point. So our meeting will continue. So that's what's going to happen on February the 9th. And the work session is 6:30 back in this room next Tuesday. All right? We have a motion to go into closed session.
I do. I move the board convene in closed session for the following purposes: discuss and consider the appointment of staff for classified positions, a coaching position, a resignation of professional position pursuant to Virginia Code 2.2-3711A1.
We have a motion for Mr. Groves, or a second? Second. Second for Mr. Ubben. All in favor, aye?
Aye.
Aye. Opposed, no. So ordered. So we're going to go into closed session in another room. I bet you we're not going to be in there more than 5 minutes, less than 10 minutes.
Yeah.
And we'll be back. And at that point, we'll have motions coming out of closed session, and we will adjourn in case you want to hang out. If you don't, I completely understand.
You going where? Library?
Library.
Long-term sub-appointments and a middle school basketball assistant coaching position. And so a short list. Entertain a motion to adjourn. So moved. We have a motion, Mr. Ubben, a second, Mr. Grove. All in favor, aye?
Aye.
Aye. Meeting adjourned. Thank you very much.
3.3. Good meeting.